Today we will discuss about pulmonary embolism. Pulmonary embolism is a condition when a thrombus moves to the lung from the leg or any parts of the body through the right side of the heart. Patients usually present with sudden shortness of breath, chest pain and haemoptysis. Patients usually have a history of long-term immobility, active cancer, history of deep vein thrombosis or pulmonary embolism, unilateral limb pain, fracture of the lower limb, knee or hip surgery. ECG may show typical S1Q3T3 pattern, that is S wave in lead 1 and long Q wave and inverted T wave in lead 3. D dimer is raised in most of the cases. Echo findings are suggestive of the diagnosis, especially in chronic pulmonary embolism. CT pulmonary angiogram is usually definitive of the diagnosis. Sometimes pulmonary ventilation perfusion ratio is performed for the diagnosis of pulmonary embolism. Pulmonary angiogram is confirmatory but rarely done. Pulmonary embolism severity and mortality can be suspected from PSI score. Pulmonary embolism is usually treated with parenteral anticoagulants such as low molecular weight heparin or fondaparinux. Oral anticoagulants are sometimes used if it is suitable. There are some conditions where novel anticoagulants are not recommended, such as pregnancy, lactation, or severe renal impairment. Therapeutic anticoagulation is usually needed for 3 months. There are some conditions where more than 3 months or long-term anticoagulation is needed, such as pulmonary embolism with recurrent venous thromboembolism, first episode of pulmonary embolism without risk factor, first episode of pulmonary embolism with persistent risk factor, first episode of pulmonary embolism with minor risk factor, pulmonary embolism with patient suffering from cancer or antiphospholipid syndrome. Thrombolysis is done in some patients hemodynamically unstable with anticoagulant. Surgical embolectomy or catheter-directed treatment are sometimes needed as alternative to thrombolysis. IVC filters are sometimes placed when anticoagulant therapy is absolutely contraindicated or patient with recurrent pulmonary embolism while treated with anticoagulant. Thank you for watching.